I think the most important thing when thinking about these little interventions, especially for moms, is not that we are trying to breed a generation of Stepford wives who feels like they have to be these perfect little feminine robots.
Right.
It's more just like meeting people where they are.
Women, sometimes we are so judgmental to each other.
We need to stop criminalizing stuff that is really part of the human condition, less judgmental of the personal choices people make about their own bodies.
Being a mom is the toughest job there is, and it doesn't come with instructions. So it's okay if you don't have all the answers. We'll figure it out together. This is Mom Brain with Ilaria Baldwin and Daphne Oz.
I'm Dr. Lara Devgan, and I'm a board-certified plastic surgeon in New York City and the mom of 6 young children. And you guys can find me on my Instagram, which is the most fun thing for me. So that's at Lara Devgan, MD.
Okay, what is an eyebrow lift?
So if
Going
you
right
we're gonna
You're
just
getting
get
at it,
right
because
into it.
I've always
Waste
wanted
no
to
time.
know.
Let's get right to it. So there's a surgical brow lift and a non-surgical. So a non-surgical eyebrow lift is with Botox, and we use Botox in a carefully placed manner to give you a little bit of an improvement in your eyebrow arch in the lateral third of the brow. So by injecting really carefully into the 43 different muscles of facial expression, we can give you a little tweak and improvement in femininity.
What is the most feminine look for a brow? Is it an arch situation? Is it?
Yeah. So first of all, it depends who you ask. I think in LA, the ideal brow is a little bit more arched. And in New York, people like a little bit of a fuller, flatter brow. But generally speaking, an ideal female eyebrow is 1 shade darker than the hair of the head. It's 1 centimeter above the orbital rim, which is this bony prominence right here.
Okay.
And the arch is halfway between the lateral limbus, which is the edge of the color of your eye, the edge of your iris, and the lateral canthus, which is the edge of the corner of the homage part of your eye.
Oh, interesting. So not at the center of your iris, theoretically. It's at the edge of your eye until the white part halfway between that.
Yeah, so if you look at your iris, between the iris and the edge of the pointy part of your eye, and you go right up, that's where the ideal eyebrow arch is supposed to be.
Interesting. I feel like someone needs to teach that to all 13-year-olds with a tweezer who think that they're like, going to just
100%.
win.
What do we think about microblading?
I think that it's not a bad idea. I mean, if you do it well, it's a little bit of a permanent commitment or a semi-permanent commitment.
Yeah.
So you don't want to microblade your eyebrows in an undesirable aesthetic manner.
Right.
But if you like it, I think it can help.
Because this is what I've been very interested in. I mean, where I'm somebody, I'll like pencil mine in. I don't have to do a lot of tweezing. Thank God, I don't know where I was in the 90s, but I wasn't plucking my eyebrows because a lot of people did, and they overplucked, and now they're, trying to grow them back in. And so microblading seems to have really helped that out a lot. But I'm just interested in it in terms of like brows are really in right now.
Totally.
And so it's like the lift, the fullness, the color.
They really frame the face. If the eyes are the windows to the soul, then the eyelids and the eyebrows are the curtains. And you can really make an impact just by having a beautiful brow. And changing the shape and the fullness and all of that can have a huge impact.
I tint mine a little bit. Do you ever tint your eyebrows?
I've never done anything to my eyebrows other than, again, over tweeze them as a teenager. But I do think, I do, which by the way is a problem because for those of you listening who are still like virgins to that, it's a problem because sometimes your hair does not grow back and you end up with these bald spots. And that's why I think the microblading is an interesting possible route for me. But I do get nervous about any permanent augmentation or change to a face that feels like in vogue right now that might not be in 5 years.
That's what I'm interested in, and I don't have all the information with microblading, but it's just like my like past 2 week like obsession with thinking about it. What I find to be interesting about it is that it isn't permanent; it's semi-permanent. So whereas like the over plucking thing ended up being permanent to so many people.
Correct.
So the question is this truly semi-permanent?
Well, so that's perfect. That is the perfect segue because I think one of the things that we were both so excited to chat with you about, Dr. Devgan, is what are some of the the non-invasive test practices that mothers in particular, let's do it this way. What are the biggest problem zones you think moms deal with? I'm sure in your practice you've seen everything under the sun, but there have got to be some that feel more prevalent than others. I'm talking under eye bags, dark circles, wrinkles in certain places, fatigue, facial sagging. I know that in my future I will have, we call it a gullet in my family. It's like that wobbly chin skin that's just going to happen. So what are the sort of most typical things that you're treating? And then what are some of the ways that you, like, how do some of these moms just come out and they did something, but you can't really put your finger on it? What are some of those techniques?
Yeah, well, so 2019 is really the era of the tweakment, and we have so many
that's
little
so cute.
Yeah, it's like a tiny
Tweakment.
little tweak treatment. We have so many little tiny minimally invasive things that can be done to micro optimize facial beauty. So if you are worried about a little bit of wrinkling in your forehead or between your brows, that can be softened with micro droplet Botox. If you are worried that you have hollowing and dark circles under the eyes, we can use a little bit of a complex sugar molecule called hyaluronic acid to soften that and make it look less shadowed. And the list goes on and on. I mean, you can give someone a little bit more cheekbone definition, a little bit more improvement in vertical lip height, and you can soften skin, complexion. Forget about the body. That's a whole other podcast.
Yes.
But I think the most important thing when thinking about these little interventions, especially for moms, is not that we are trying to breed a generation of Stepford wives who feels like they have to be these perfect little feminine robots,
right,
with not a wrinkle in sight. It's more just like meeting people where they are. And if you feel like you want a little something to feel more like your old self or a little bit more confident, and it can be done in a safe and medically responsible manner, then there's a lot of stuff that we can talk about.
Do you feel like you're talking your patients off a ledge a lot? Are they like coming to you saying, I want duck lips or whatever? And you say, are you, I guess, what's the process? Someone comes to you with their face and here I am. Someone say Daphne comes to you with their face. And what's the process like in terms of how you help them navigate what kind of tweakments they might like to have done?
So I first start just by asking someone what their concerns are and, just understanding why they're there. And a lot of times people will come in with a really specific reason, like, I'm concerned after breastfeeding my 3 children that my breasts are deflated and I want them to look a little bit more like they used to.
Raising my hand right now.
Yeah. Right? There's all this stuff you don't think about. So sometimes it's something really specific like that. Other times someone will come in and they'll just say, you know what, I feel great, but everyone is asking me why I'm upset and tired looking. So can you just help me feel fresher? Sometimes people have an ongoing problem like acne scars or wrinkles. And other times it's a more discrete thing like, they're concerned about neck laxity and they are interested in a surgical facelift. Mm-hmm. So people are very different. And I think part of the art of plastic surgery is super customization. It's a bespoke field because every single person is different. Everyone's anatomy is different. Every approach is different.
So you don't have like the Devgan look. You don't have a...
No, I don't. I mean, I think if I were to describe like the Devgan look or, I've had patients call it the Devgan glow up. I would say that I really like this idea of micro optimization where it's almost like a Snapchat filter or a Facetune where you can make a bunch of tiny millimeter level changes so that you can't really tell that anything is different, but someone just looks better.
Well, see, that's the thing is that, I think that we all have this bad, going back to the 90s, what people did to their faces, and it wasn't
And they all look
good.
the same now.
And they all look the same, and they regret it. I've definitely had conversations with people who really went overboard and they regretted it. And there's their doctors who told them that this is what was to do. So I love that right now as people are starting to get into, it is these micro things and it is things that are not necessarily permanent. And allowing, we need to age. Like the face
Completely
needs to age, but how can we do it in a way that we like better? There is no fountain of youth. I think, if that's right, no.
No, I know, absolutely. But I think, the same way putting on a great outfit can help you carry yourself differently, can help you put forward your best effort. I think aging gracefully is is obviously the goal. But I think every once in a while your biology sets you up for, a specific thing that makes you feel older than you are, more tired than you are. Like what you just said, someone comes to your office, I feel amazing. Why is everyone asking me if I'm tired? First of all, that is the rudest, most annoying question ever.
Or when your kids ask you, like, Mom, why are you mad? And you're like, I'm very happy.
Can't you see? But yeah, no, because I do think I go back and forth. On the one hand, I think I get kind of chicken about the idea that whatever it might be that would bother me about my face, if I did something that was permanent and I couldn't go back on it, I would hate what I did more, or I would, I would regret it. I would
because it's not an outfit that you can take off
completely, and because my grandmother is who I go to for all kinds of life advice, and I always think she's so wise on this. But she's the type of person who is. I don't know. I think for her generation, it was very much what you not even just respect, what you admire and what you're sort of find so beautiful are those women who you see the lines of their life, you see the experiences that they've had reflected with them, but they've taken really good care of themselves. Yes. And I think I want to find a happy middle ground. If I do want to take really good care of myself, I don't want to rely on interventions that I don't need to. But I love this idea of being able to test things before you have to fully commit. So I follow you on Instagram. I love getting to see these sort of non-surgical rhinoplasties, and under eye bags is something that I think a lot about. And there's, like you were saying, you were holding up this crazy look. It looked like fake ice, and it was the sugar molecule that would eventually become filler. And this idea that you can use filler to fill in, hollowing under the eyes or whatever. I love that all of that can be done so you can see what the effect would be without actually having to commit to it, because it can all be dissolved. Again, a lot of life is just comparative. If you're looking around you and all your girlfriends are not aging the same way you are, it's really not fair.
Yeah. And I mean, I think that also, like, kind of on a bigger level, for so long, society has beat us down with this message that you can either be a person of substance or you can be a frivolous person who cares about their looks and is obsessed with their appearance. And, where is the gray area in between? Like, we are complex humans and men and women, and you can be a feminist with lipstick on, and you can care about your appearance and also make meaningful contributions in the courtroom or the boardroom or the operating room or the
doctor.
Whatever. Right. I'm saying. Yeah. And so, I kind of think that we need to stop criminalizing stuff that is really part of the human condition. Like, since the first Neanderthal looked in his reflection in a puddle a zillion years ago, people have been wanting to work on their abs and color their gray hair and wear a certain kind of heel because it makes their legs look better, and et cetera. And so it's really a slippery slope between that and, a mascara and getting rid of your wrinkles and feeling a little more confident with the straighter nose. And I just kind of think that we need to be less judgmental of the personal choices people make about their own bodies. And it does not mean that this is a PSA for plastic surgery.
Right. I mean, and I find that women sometimes, we are so judgmental to each other. I mean, men, a lot of times they won't even notice. They don't care. They're like, do whatever you want, whatever. I just want to, do X, Y, and Z by the end of the night. You know what I mean? Like, whatever. But you know what I mean? Like, I think one of the things that we try so much on this podcast, and I'm sure that as you guys are all listening, some of you guys are thinking, no, don't do anything ever. And then some of you guys are like, I want to hear this. Ask more questions. Ask more questions. So, I mean, I think that the most important thing is exactly what you say, whether you're putting on mascara, you're coloring your hair, or, you're wearing a certain shoe, or you want to do some Botox and some filler and stuff like that. It's whatever makes you feel better at the end of the day. And if you're doing it with good intentions and good reasons, then everybody stop being so judgmental.
Yeah.
It's
So can we ask more questions now? That we put that? Okay, that was the fun part. Okay, so now more questions. Okay, how do you make sure for people, I mean, not everybody's going to be able to come and see you. I think one of the biggest fears that people have is that they're going to leave there and they're going to look scary.
Yeah.
And we know that it's possible because it definitely happens. So women or men who are listening to this podcast who are going out there and they want to do their lips or do their cheekbones or do a little Botox or whatever it is, what kind of conversations, how can they find somebody who's good? What kind of conversations can they have with people to explain exactly what they want?
I would say take your search off of Instagram. Like, sure, start there because we all live on our cell phones now. But research someone's credentials. Make sure that they're the real deal. You know, I'm a board-certified plastic surgeon. It takes 20 years to become an overnight sensation. And, you know, make sure that the education and training and all of that is there, because it's sort of like, you know, friendship, where everything's great when the sun is shining. You need someone who's going to be able to solve a problem and take great care of you in the extremely unlikely event of an emergency. And that's where credentials really make a difference. I would say look at before and after photos. You know, there's no one cookie cutter approach to a breast augmentation or a facelift or Botox or non-surgical rhinoplasty or any of these other cool little things. But if you look at a lot of different example images, you will see people who remind you of characteristics that you might have. And you might see some results that you hate and some that you love. But if you just get to know a surgeon's body of work, then I think that will give you more comfort. And then the final piece of advice is trust your gut. And that's true for everything, right? So if you walk into someone's office and you have it all set in your mind that you're going to do X, Y, and Z, and for whatever reason, you get this sinking feeling like this is not right or it's not what you think it's going to be, then just, you know, elegantly exit the situation.
Thank you very much.
Does it help you when people show up with like, I want to look like this person, or you know, do people show up with inspiration images? I mean, is it like Pinterest? How do they guide you into what they're sort of looking to achieve?
Yeah, you know, that's such a good question. People often show up with inspiration images, and even more recently, people are showing up with their own Face-tuned and Snapchat filtered photos, which is like so cool and interesting.
That's so meta.
It's so meta. I mean, in previous eras, people would come in with the cover of a magazine, like make me into this beautiful supermodel. And now people are coming in, and in a way, it's a democratization of beauty. And I almost think that it's more healthy.
I was going to say, I absolutely love it. Well, people said to me, you know, if I ever, because I, you know, I've had 4 babies that I've breastfed, and, you know, you like sort of, you dream, and who knows what I'm going to end up doing. But people say, take a picture after the first engorgement, when your boobs are exactly like you like them. Take a picture, and that's the picture.
Do you have a picture of your boobs before you had kids?
My husband does.
But you'd want to take them to you'd want to make them with what they look like.
You know what's interesting? So when I broke my hip about a year or so before I met Alec, and so I started swimming, and I was swimming breaststroke with my head above the water because I'm very vain about my hair, and I didn't want to put it right. So I wanted to exercise, but I couldn't run at that point. And so I was doing breaststroke, and I lost my boobs from doing the breaststroke. I know, because I had boobs before, lost them. They came back when I stopped swimming. I know, interesting. So I have like photos of like when I first, you know, started dating Alec, but my body was different before that, because at that point I was, you know, swimming to recuperate my hip.
Right.
So it's like, I mean, yeah, I'm sure I have photos of different things, but I feel like, you know, some parts, I mean, who knows, but like some part of me feels like, hey, you know what, it was kind of nice when you had like a little extra milk in there to like lift them up. And people always accuse me of getting my boobs done. I'm like, I just had a baby. Do you guys know nothing? Like, yeah, so when I was in there, I pushed the baby out, and then I had a surgeon put some implants in at the same time.
You're a good multitasker.
Yeah, multitasker, so efficient.
What are some of the, let's talk breasts, because I think people, we are moms, we are focused on them.
Our kids are focused on them.
Our husbands are really focused on them. Everyone is obsessed with our boobs. What are some of the options? Because I know there's like, first of all, nipple reconstruction. I feel like my girlfriends and I somehow inevitably end up talking about that whenever we go out to dinner, which is bizarre. A breast lift, breast augmentation, restructuring. Like, what are these sort of options?
There are so many options. But a lot of women who've had kids experience deflational atrophy. And basically that means that the breast tissue shrinks because you have all these weight fluctuations. You're gaining and losing sometimes 50 or more pounds per pregnancy. And then every time you engorge your breasts for nursing and then deflate them, that's kind of more stress. And imagine like
accordion,
you know, an accordion or a rubber band that you stretch. After time, it loses its elasticity, so you can get really deflated. So
is that why the fatty part at the top feels like it gets flatter? Like,
yeah. And they used to be perky, and now they're not.
And then not only that, but like the breast tissue that you do have is a little bit looser, and so it's not quite as like plump and youthful and firm as we all recall. I have 6 kids, so I totally appreciate this.
We're gonna get to them
on a personal level.
By this.
But so the options are breast augmentation, which is with an implant, and that can be used for lifting as well as size. There's breast lift, which can be used if you like your size in a bra, but you just want them to be higher and perkier, and you can even use your own tissue to make them a better shape. There's breast reduction for women who have breasts that are too large after all of these changes. And then there's a combination of the above. And that's where we super customize things. Like sometimes people need a small implant and a little lift, or they have asymmetry because their kids favored one side.
Oh, yes,
which is,
of course.
Switch up those kids, by the way. That's my public service announcement.
What's the sort of most natural looking result? Well, what's your favorite implant? And then what's the one that sort of gives you the most, again, youthful looking, but perky?
But natural?
Yeah,
okay.
natural.
So I like smooth, round implants. Most of my patients, about 95%, will use a highly cohesive silicone gel implant, which is kind of colloquially referred to as a gummy bear implant.
I've heard that those can be dangerous, though.
No, so here's what you're hearing. Textured implants are the ones that are coming under a lot of fire.
That's different from a gummy bear.
So gummy bear just refers to the squeeziness level of the implant.
Okay.
There's also texturing. So I like smooth implants that are not textured because we avoid all of the issues associated with textured implants, which can be malrotation, seroma, or ALCL, which is a super rare entity that has been reported in a very small number of women with textured implants. So I think, generally speaking, getting your best advice from your plastic surgeon is probably going to be the best thing to get you the result that you want. My preference is for smooth, round, squeezy implants that are highly cohesive, which means that even if you cut them open, they don't leak. They kind of maintain their structure.
So smooth round means does it cover the whole boob, or does it just go under the boob? Like,
the entrance point. There's all these different. I've learned that you can go through the nipple,
or the
armpit. You can go underneath. You can go through the armpit.
So that is true. Very good.
I'm somebody who I will pick your brain. If you can't tell, I will know absolutely everything about it 10 years before I do something.
So I feel like you really did your homework. You're really good at that. I think the most preferable location for an incision, and the one that I've used even on models and people who don't wear clothes very often, is underneath the breast fold, so in the inframammary fold, and that's shadowed very well and it heals really nicely. You can also place an implant through the areola or in the armpit, but those are slightly more contaminated roots, and so there is a slightly higher risk of infection and something called capsular contracture if you go through one of those things.
And then I've also heard that if you do that through the nipple, you could lose sensitivity. Although after breastfeeding so many children, I mean, who's kidding? Who?
How do you maintain underboob? Because if you want them perky, but you still want the, side boob and underboob, how do you do that?
So that's just kind of with careful technique. It's sort of like the artistry of plastic surgery. Imagine if you give 100 people a piece of paper and a pencil. Not all 100 are going to make a picture that you want to put on your wall. Maybe only 1 or 2 of them are going to make a drawing that you actually like and would put in a frame. And so I think that everyone's different about what they like in their taste in art, whether you want, a Warhol or a Kandinsky or a Van Gogh. And so you sort of have to find your surgeon who has your speed and your aesthetic vision who can help you get the result you want.
What's your favorite procedure to do?
Good question. I love 3 things the best. Face and neck lift, eyelid surgery, because that's just so compelling. And I think facial identity and facial beauty is, really precise and down to the millimeters. And I love breast augmentation. So those are my top 3 surgical procedures. And then for non-surgical, I love facial contouring with injectable fillers. And my non-surgical rhinoplasty is the one that's gone mega viral. And then I love the cheekbones represent 70% of facial beauty. So I love a little bit of cheekbone, jawline. I think you can do really elegant things. And just with this idea that beauty is in the millimeters and that it's all in the details, and just tiny little tweaks can change the feeling of the face.
Okay, so For those of us who are, I haven't done anything because I'm still having children and have this idea in my head, not well researched, but I have this idea in my head that like, okay, have the kids, then get into it. But who knows how many, going at this, who knows how many kids I'm going to have. And especially looking at you, all of a sudden I feel very competitive and I need to have 2 more. Maybe I'll do it with twins and then we'll be done.
I know. I just want the twins.
Yeah, the twins would be so much fun, except carrying
You guys,
them.
they're murder on your body.
I know,
though. I
I know,
had a
that's
set of
unfortunate.
Okay,
twins.
so what was
But
that?
you're so tiny.
I know. What was your recovery from that? What was the deal there?
Okay, so I have 6 kids. I have a 7-year-old, 4-year-old twins, a 3-year-old, a 2-year-old, and a 9-month-old.
Oh my!
I love
What is
it.
bedtime like in your house?
It takes a while. It's not as restful as you'd hope. My twin pregnancy was the one where, that's a tough pregnancy, especially I'm not the hugest person in the world.
No, she. For those of you who cannot see, she's tiny. You, I believe, you're smaller than I am. How tall are you?
I'm like 5'4" or 5'5".
No way. Oh, I'm 5'3".
You're
We'll
very-
measure them
you're
after
very, you're very thin and slim.
I think it's, but I wear heels all the time, so I just think I'm taller. So twin pregnancy, and I want to get back. I want to know what
we're
you
going
can
back.
do,
We're going
Daphne.
back. We're going back. We're going back. After
Okay.
twins.
So twin pregnancy. Okay, so I probably gained 50% of my body weight or more in order to have the twins. And it was one of those things where I felt really chic from my singleton pregnancies where like from the back you couldn't necessarily tell I was
And
pregnant.
you started with a boy
But-
too. Your first was a
yeah,
boy?
but for my
Yeah.
twin pregnancies, it was like a gigantic beach ball, and you could tell from
Wait,
all
are they
angles
boys or girls?
that my twins are boys. They're
So you
fraternal
had
boys.
boy, 2 boys.
And then my 4th is a boy, and then my 2 babies are girls.
Oh my goodness.
Did you want to make sure that you had sisters for the girl, a sister for the girl, and brothers for the boy?
Yeah, I think, I'm one of 4. My husband's one of 3. We didn't really plan on having a big family. We thought maybe we'd have 3 kids or something like that, or maybe 4. But then we had 4 boys in a row. They're so adorable and awesome. But I was dying to have a daughter. And so we went for it and had a daughter. And then we had a little sister for her.
That's so nice, because that's my thing is that I have 3 boys. So then when you say 4 boys, I get like, oh God, I'm never going to they keep me in shape. They just run. They just run. They go. They don't listen. You have to grab them by the wrist because they will take their hand out and then run into the street. It's so stressful in New York. And Carmen, my daughter, just listens, not about everything. And she'll have her dramatic moments. And she's she's super dramatic. But the boys are no joke. And the idea of even one more. When I found out I was pregnant with a 3rd boy, I have to say I cried for a little bit. And I love him. I named him Romeo. He's my Romeo. I don't want him to be anything other than he is. But he was I was scared. I was a lot. There was a lot of boys.
Yeah.
And you have 1 more.
Boys they're a lot. Yeah, they're a lot, and they just don't like to sit still. Mm-hmm. So
I have that in common with them, though.
You are. You
So
are the
it
most
is-
hyperactive human.
I know. Fortunately, I'm a little bit in there with them. But one of the reasons that I want to have another one is I want to give a sister to Carmen.
that's sweet. Sisterhood is super cute. But I think you can have an awesome family no matter what mix of kids you have.
100%. It becomes your story. And all of them are super special. But I will make it happen. Okay. So going back
But
to
by the way, the twins destroy your body. That was my
that's
my
what I
2
really,
cents.
because there is a part of me, I would absolutely, you get what you get and you don't get upset, but all families are in a weird way, they always work out the way they're meant to be. The dynamics are at play there that are just so beautiful. But there's a part of me that would love to have twins if I could engineer for it next. And some people are like, no, it's fine. It's a breeze. No big deal. And I look at you and I would never know you had twins. You look amazing. And all my girlfriends actually, weirdly, who had twins are exactly like that. So thank you for being honest that it was actually really tough.
It was a difficult pregnancy, and it was I was dragging it out till the bitter end.
How are you working
I
like
made
that?
it till 36 and a half weeks or something. For my twin pregnancy, I think I stopped working around 34 weeks or something like that.
Still, that's
a lot. That's a lot.
How do you juggle I'm scared, but also really tempted to ask what's dinner time like at your house? Because you come home from a long day. You're expected to be hugely professional, obviously. And when do you decompress? And B, what's life? A lot of people with lots of kids will say they kind of live life like a drill sergeant. People have their rhythm and their routine because otherwise it is just absolute chaos. And other people have, their sort of free for all attitude. So what's dinner time like at your house?
So dinner time is, I'm fortunate that we have like a lot of help, I am the first to admit that my kids get a lot of stuff from me and I teach them different things, but one of those things is not, how I'm making them dinner every night. So I don't really cook very much. Kind of like cookies once in a while, that's my speed. But so for dinner, all the kids eat their own thing. We try to have everybody eat the same thing, or at least a couple of bites of the same thing. For our baby, who's 9 months old, we'll mash up the adult food and like kind of.
It's so important. You talk about that all the time.
To try to give them a little taste of that
and stuff like that.
Yeah, and then we just kind of make it work. I used to be really stressed about making sure my kids ate enough because I think I've inherited this like fundamental mom tendency to want to feed your kids.
Absolutely.
But now I'm kind of like, okay, they're not hungry. They're going to stop eating when they're ready.
When women are in the years of having babies, is it safe to do? What do you tell people?
Okay, so don't do anything that's not essential when you're pregnant or breastfeeding. And that's the best rule of thumb. You can definitely do whatever you want in between pregnancies, and you don't have to wait. Mm-hmm. And then just in terms of like a Botox and Filler 101, because I know like everybody's curious about this, Botox is an injection that smooths wrinkles. It lasts for 3 to 4 months. So most of the time people will need to do it seasonally. Fillers can last anywhere from 3 months to 2 years. And those today are fully dissolvable and they can be used for contouring. So they're almost like, clay or a modeling clay type of substance. And you shouldn't do anything that presents a needless risk to your baby. So if you're trying to conceive, you can do whatever you want. But the minute you get a positive pregnancy test, you should stop. I will say that I have accidentally gotten Botox while I was in early stages of pregnancy. And, truly on a scientific level, it likely does nothing because it doesn't travel systemically, and the same with fillers. But it's one of those things where, life doesn't make you any promises. Bad stuff happens sometimes. And why enter into that whole realm?
Yeah, no, because that's what I've heard. Like some of my friends, they like freak out. They're like, oh my God, I just had Botox. But because some people will say, don't do it for 3 to 6 months before you get pregnant. Right. And they'll have had that happen and they found out they were pregnant, they weren't trying, whatever.
Yeah.
And they got pregnant and then they're sure that their baby is going to have all sorts of problems.
It truly doesn't matter. The moment you get a positive pregnancy test is when the embryo implants into your uterine lining, and that's when it's getting part of your systemic circulation. So even if you imagine that Botox is in your system, which it's definitely not, but even if it were to be, it wouldn't affect a free-floating embryo, let alone an oocyte or egg.
What, if you're comfortable saying, do you let anyone do to you? And who do you let do it to you? Who's allowed to touch your face?
So I do like a little bit of the things, and I think that I really like practicing what I preach. So
do you do it yourself?
I do my own Botox.
Wow.
Yeah. I think that, if I could clone myself, I would.
Right.
But it's one of these things where I'm a super detail-oriented and picky, meticulous person, and I want to make sure that things are kind of done to my specifications. But I use my own medical-grade skincare every day, and I like Botox. I think a little bit of judicious use of injectables can help maintain the way you look over time without making you look very different. Mm-hmm. And I just think that overall, sometimes some of the best things that you can do are free. So if you sleep on your back, if you avoid the sun, don't smoke, don't drink excessively, just some of those simple things that on some level we all know we're supposed to do.
Right.
That stuff makes a big difference.
So you run your own practice.
I do.
Which means you work for yourself, which is amazing.
Which is key for my life to be able to exist in its current form.
Was that scary for you when you went out on your own? Like, what's
totally.
been the best part and the worst part of being?
Oh my God. I have been in practice for 5.5 years. And 5.5 years ago, I was a nobody. I mean, I was like, I trained at all the best schools, and I'm not going to make you guys roll your eyes and gag at my CV. But I did have a great pedigree and good credentials and excellent training. But, when you start a business, you're nobody. And I remember talking with my husband saying, okay, if I don't break even in a year, let's talk. And we'll reevaluate if this is going to work out. And I broke even in a month. And it has been really, truly incredible. And I think I credit a lot of the success of my practice to amazing patients, some of whom have used their public platforms to be honest about a field where there are so many stigmas that unfortunately in the past, that's what's driven plastic surgery completely underground to these horrible back alley situations where people are getting bad things happening to them by unlicensed practitioners in hotel rooms and behind alleys, just horrible stuff. And that happens because people are afraid to talk about it. So I have been really fortunate that I've taken care of some, really amazing and generous people who've
spread the word.
Spread the word a little.
But that's kind of amazing too. So you have a 7-year-old and you have 5-year-olds. 4-year-olds.
4-year-olds, yeah.
Okay, so
right in
during
between.
this, and your practice is 5 years old, exactly. So you really had one every single year, essentially, including your practice, and then you proceeded to have 5 children as
I built the practice. Yeah. And so, when you work for yourself, the great part is that you can do whatever you want, but the difficult part is that you're your own strictest boss too. So I took a very small amount of maternity leave. I did arrange my schedule so that I could spend some time with my kids, but it's something that I always think about. And it's not so much about the work part of it. It's more just I want to be present for my patients.
Right.
They become like children in a different way. You want to take care of them and make sure
they might think they need you more.
No, it's so important for them as well. I mean, they're coming to you and they're putting their face in your hands.
Yeah, I mean, I was just talking about this with my assistant on the way here, that we were talking about how the weird thing about this field is that a totally regular, ordinary day in my life could be the most important day of somebody else's life.
Right.
And that every day I try to remind myself to stay idealistic, never get cynical, and always put myself in somebody else's shoes. Because even though it's a random Tuesday for me, for them, this could be a really huge deal. This could be the surgery that they've been planning on for months. They've gotten childcare. They've made this big financial commitment. It's a huge deal. It's their body. It's a permanent change. My hands will stay with them forever. So I think you have to kind of be deadly serious about some of those things.
Yeah,
Absolutely.
100%.
What's the one thing? Sorry, we're going to let you go soon. I have 3 questions, and maybe you can answer any of them that you want. What's the one procedure you think everyone, I always say, I think if everyone in America would take probiotics, I feel like we would all feel better, look better. It would revolutionize the way that we operate. What's the one procedure you feel like everyone would love on themselves?
That is a good question. Okay, it's a toss-up between a little bit of simple Botox, because not only does that make you feel a little bit fresher and look a little bit fresher, but if you're not as able to scrunch and frown as your resting expression, it elevates your mood a little bit. It's sort of like that old adage that everybody's mom tells them.
Headaches.
Well,
that if you go not Botox.
Yeah.
When you
the
scrunch,
scrunching,
the
yeah,
scrunching,
that's a
and
tension headache.
Some people who do Botox, they do it because it's supposed to
release the tension. Oh, that's interesting.
Yeah, so it's kind of a little bit of that. And then my Thai answer was going to be microneedling. So I do this amazing facial called a gold Infusion microneedling, where we micro-inject the dermis, thousands of tiny little needle pricks, and it's not painful, even though it sounds like it is, but they each stimulate collagen and elastin production. And then we also deliver a customized cocktail of Botox, hyaluronic filler, and platelet-rich plasma, which is PRP from your blood, into the skin. And, to make a long story short, it basically just gives you this dewy, glossy looking skin. And even though we all get preoccupied with wrinkles and lips and cheekbones and all of that, there have been a lot of studies that show that the main thing you feel when you're looking at someone's face is the quality of their skin. So that's what gives you the like feeling of their age and vitality and youth.
Wow.
Interesting.
That's so interesting. What was the second question?
The second question was, what has been the most fulfilling day of your career? What's been the most exciting procedure you've ever gotten to do?
Gosh,
Or the most botched thing you had to correct.
Okay, those are two very different questions. I think that to me, really, every single surgery is like everything to me. It's hard to explain, but every single operation is like me standing at the, free throw line with 3 seconds left on the shot clock, and it's sort of like it's an opportunity and a desire and a struggle to try to make something exactly right and exactly perfect. So there are certainly minor procedures like a little mole removal and major procedures like a face and neck lift, eyelid, breasts, tummy tuck, et cetera. But at every point in between, it's this ultimate responsibility where my hands will stay with someone forever, and the scars are permanent. So if I make them beautiful in an inconspicuous location and make everything as perfect and symmetrical as I can, then it's so meaningful to somebody. So I try to bring that same level of seriousness. But I mean, in answer to your question in terms of like the shock value answer, when I was in residency training, so I trained at New York Presbyterian Hospital, Columbia Cornell, which is this amazing top-ranked place.
She had her last baby there. I've had all my babies there.
I had all my babies there too.
There also.
Yeah. And actually, I knew your dad when I was a resident at Columbia.
Oh,
yeah.
No kidding. Amazing.
And I've scrubbed with your dad before.
So cool.
Which is so cool. I was like the anonymous little one in the back row, but
I'm sure not. That's awesome.
I think in those times, like what your dad does is amazing. Cardiac surgery is incredible. Transplant surgery is incredible. When I was a second-year resident at Columbia, just being able to participate in getting on an airplane, like on a private jet, and flying to retrieve organs from an organ harvest and bring them back to Columbia and help the team put them in another person and kind of the cycle of life. There's some really poignant moments in medicine. And now in plastic surgery, face transplantation is doing that for reconstructive problems where people have horrible dog bite or fire injuries.
That's
things
amazing.
Like that. It's an incredible field.
Wow, that's amazing. Wait, she has one more question. What's your last question?
I'll ask her off camera only because I want to ask her, if you're going to do one thing to my face, what will it be?
You guys are both like impossibly perfect for
That's
those
not
of you.
true. She's being nice. As soon as the
I'm
mic goes,
seeing
she's
them
gonna actually
super
tell
up
us.
close. This is my professional opinion, and
yes.
I think you guys look amazing and beautiful.
Well, especially our lips, because we just used her lip plumper.
Our lips are fabulous. They've never been better.
Guys, definitely check out this lip plumper thing that we just used. It smells, and I don't want to say maybe it tastes like, but I shouldn't
Watermelon.
taste it.
Don't taste it.
Taste
But it gives the
Don't
sensation
taste
of tasting like watermelon.
Yes, your idea is to taste like watermelon, and I will work at not chewing things off my lips.
And it's really nice. It doesn't sting. Like, when there used to be those lip plumpers that would feel like cinnamon or something was biting your lips. This didn't feel like that at all, but it
felt
looks
nice.
amazing. I'm in awe.
Yeah.
I like
so
it.
if you're not ready to do your lips, then
Let's
just do
just
this.
put a
Just
little-
use a
just
little
put a
platinum
little
lip
lip
plumper.